at the beautiful Aesthetica office here in Linden with Dr. Kimball Crofts. Today we're talking breast augmentation, some of the biggest misconceptions people have.
Yes.
There's a lot of them.
There are a lot of them.
So first let's talk size, because I'm sure a lot of people think you have to get huge ones. If you get them done, they have to be big.
Yeah, well, people have different, ideas of what the breast should be, and as of late, there's been more of a trend towards a smaller breast, which I think is good. I think it's more natural. It looks better on the individual. But there are people that need or want bigger implants for one reason or another.
Yeah, and you will talk to them about all of their options as well when they come in and come up with a good option for each person.
Yeah, and it's actually, there's a lot of pressure out in society of people to do this or that from a boyfriend or a family member, whatever, or they're concerned about a social group. So we try to get to the bottom of what the patient wants and clarify what it is that they really are trying to achieve and accomplish, and then do that.
Okay, that's great.
Because you want to do your best to get that patient in and get the size they want, so that they're not too small or too big later on.
Yeah, let's talk about placement.
Yes. Well, implants can either be placed under the muscle or under the breast gland on top of the muscle. So subglandular or submuscular.
Is one better than the other?
Well, it depends on the situation. Most people put implants in under the muscle. There are less capsule problems. They just do better overall.
Okay.
When you go on top of the muscle, you have less tissue covering that implant, so you're more likely to see some rippling or some contour regularities in that implant.
Okay.
So generally, we go underneath the muscle. If there's a bodybuilder that's doing a lot of lifting, then they tend to go on top of the muscle.
Interesting. That's so interesting. Okay, what about getting a lift with your augmentation? Do those two have to go together?
Yes and no.
Okay.
No, they don't. There are different degrees of lifts that need to be done. If it's a more aggressive lift, sometimes it's not prudent to do them both at the same time because you can have problems with blood supply to that nipple.
Okay.
So if it makes sense, yes, we can do them together. Most women like to do them together because they like to get it done in one operation, but sometimes it's not the safest thing to do.
Okay, and how long do they last? We've heard a lot about how they used to not last for very long. What's the average time?
Well, we're telling people about 15 years is when they need to think about it. The FDA recommends you swap them out about every 15 years or so. Don't necessarily have to do that, but that's what's recommended. The reason for that is they have a concern that you may get what's called fold failure. So if the implant's sitting in the pocket for so long and it's sitting like this and this moves back and forth, maybe this will break and then the implant ruptures. So they're saying if you get it out before 10 or 15 years, you can maybe avoid that and swap them out.
Should people be coming into you getting regular checkups after they get a breast augmentation done?
What we usually do after we've gone through that first healing period and get them all set up and everything's good, which usually takes about 2 months, then we don't see them back for a year. We always follow up at a year to make sure they're okay, and they're always welcome to come back anytime. But most people don't come back after a year.
Okay.
They do their fine. But if you've been out good 15 years, it's probably reasonable to go in and have somebody look at it. But if they're doing fine, I don't think you really have to worry about them.
Oh, great. Okay, and then last question. A lot of women wonder, can you breastfeed with implants?
Definitely. Again, the implant's placed the muscle under the breast, and so it really shouldn't affect breastfeeding.
Okay.
The nerves come in from the side and run all that.
Well, I learned so much today, and people can come in and ask you any questions they have as well. They just need to make a consultation?
Yeah.
Okay, easy enough.
Yeah, and we recommend, that they sit down and write down their questions and look things over, and then we come in and just have that discussion.
All right, Dr. Crofts, thank you so much for inviting us down.
Thanks for coming.